Hi everyone, I'm Sean Duhamel from the Mass Retirees Association. Welcome to the first anniversary of our weekly video updates. I hope that you have enjoyed getting these updates over the past year. I hope that you find them informative and interesting. And we are amazed here at Mass Retirees of the growth of the audience that tunes into these updates every week. Not only are we posting them on Facebook and on YouTube, but every Friday we email this video out to all of our members who we have an email address for. So it's tens of thousands of public retirees have access to these updates every week. The intention here is to share as much information with you as we can, get relevant news to you, just so you have a better understanding of what's happening with your retirement, and as well as all of the issues that directly relate to you as a public retiree. And it's something that we're going to continue to do. We want to find as many ways to communicate with you as we can, from our traditional newsletter that comes out every other month, to the hotline that we update every Friday, to our website, to our Facebook page, to these videos and the email blasts that you receive from us. And we are only focused on the issues that are directly related to your retirement. So again, thank you so much for tuning in. This week, I want to jump right into the issue at hand, which of course is health insurance. And we have been reporting now over the past couple of months that there's been a lot of activity, as there normally is this time of year, of setting the health insurance rates and the plan design for what your health insurance plans are going to look like and how much it's going to cost you for the next fiscal year. Fiscal year 21 at the state level, as well as for every city and town in Massachusetts, begins on July 1st. That's the normal fiscal year, and I believe most of you are familiar with that. As we've reported over the past month, the State Group Insurance Commission, which by the way insures 465,000 people, it is the largest health insurance pool in Massachusetts, both public sector and private sector. It has tremendous buying power having that many people insured under one entity. And they do a really good job. And over the years, despite the fact that we have had some disagreements with the GIC, which is normal, just like we could disagree with any policy at different times, the folks who work at the GIC, who handle these issues day in and day out, the folks that answer the phone when you call there, they care about what they do. They work their tails off to try to get it right. And most importantly, they have the same health insurance plans that you have. They're paying the same health insurance premium rates every month that active employees are paying. Everybody's in this together. So they're not getting one set of benefits and everyone else is getting a different set of benefits. Everyone's in this together. Everyone has a stake in it. Now, the GIC voted back the beginning of February to hold the line when it comes to co-payments and deductibles. And what I mean is that there will be no increase in your co-payments or the deductibles that you pay for the coming year. And what we had been waiting to find out is what the monthly premiums are going to look like. Now, yesterday morning, the GIC met, the 17-member commission met, and they voted to approve the premium contribution rates for the coming year. Now, we expected that rates were going to go up, and the range that we had been expecting was somewhere between 4 to 5% on average. Now, that's across all of the plans the GIC offers, covering all 465,000 people. Now, the good news is for most of our members, and most of our members are insured under Medicare, not all, but most, the rates for Medicare are going up less than what we expected, 3.3%. For the optional Medicare extension plan that's run by Unicare that insures nearly 104,000 people just under the Unicare OME plan. It is the largest plan the GIC offers. And again, the monthly rates are going up 3.3%. Now, obviously, we're not happy about this in the least bit. We're not happy that our members have to pay more money. We're not happy that year in and year out, these healthcare costs keep going up. But again, we anticipated this coming, and we understand the reasons why this is happening. Now, the reason is quite simple. Health insurance inflation continues to rise. And what I mean by that is that the cost of prescription drugs, doctor's visits, tests, procedures, all of those healthcare services that all of us receive at different times, the cost of those services continues to rise at at a pace that is much higher than normal inflation. The state is not making money off of this. The insurance companies that are administering these plans are not making money off of these increases. It is the drug companies, the hospitals, the doctors, the testing facilities. All of those medical entities are the reason why these costs are going up. And something has to be done to stop this from continuing because, as we all know, retirees, active employees, public sector, private sector, nobody can continue to afford these prices going up year in and year out. And we are trying to do several things about this. Now, obviously, the big picture is that nationally, the federal government has to do something to get health insurance under control, to provide excellent quality insurance benefits and healthcare benefits at a price that's affordable to everybody, because the current model, as they say, isn't sustainable for anybody. But until Washington gets his act together and actually can sit down and figure this out, here at the state level, we need to do our part as best we can to try to come up with some solutions. Job number one for us is coming up with a way to alleviate the problem for non-Medicare retirees. Now, these would be retirees who are over the age of 65, who did not earn enough quarters under Social Security or Medicare. You need 40 quarters to qualify, and their spouse also did not earn enough quarters to qualify for Medicare. So these retirees, the only option for them traditionally has been the regular health insurance plans, the non-Medicare health insurance plans that the active employees are in, which are fantastic insurance products. The problem is they're very expensive. Right now, at the state level under the GIC, for the non-Medicare plans, is a $500 annual deductible that these retirees are forced to pay. The co-payments to see a doctor range anywhere from $25 all the way up to $75 for some specialists. Whereas retirees who are insured under Medicare, there's no deductible, and the co-payment to see a doctor, regardless of the type of doctor it is only $10. And I know for a lot of members, $10 is still a lot of money. And if you're going to multiple appointments every single month, these costs add up for everybody. But they add up even worse and more severely for our non-Medicare retirees. So what are we trying to do about this? Well, we are working very closely with Blue Cross Blue Shield and Harvard Pilgrim and Tufts, and with municipal governments and the health insurance administrators across the state, the largest being an entity known as MAIA, the Massachusetts, it's MAIA. I'm blanking on, I'm sorry guys, I'm blanking on what the acronym stands for, but MAIA is the plan administrator for 130 or so municipalities across Massachusetts. They strictly offer Blue Cross Blue Shield health insurance products. MAIA has been instrumental in the transition at the local level for non-Medicare retirees to buy into the Medicare program, and it's been highly successful. We have been reporting on this in our newsletter for the last several years, and we have more and more local municipalities buying their way into Medicare, which is a huge relief for these retirees who are impacted. We are also working with the state GIC to come up with the same type of approach at the state level. And unfortunately, this is going to take some time. The GIC has several thousand, perhaps up to close to 10,000 retirees, and we're still trying to grapple with the exact number. But that high number of retirees, every single person has to be identified, and it has to be calculated of how they can be enrolled in Medicare. At the earliest, we're looking at the state level is a July 2021 transition date, and we're not sure about that yet either. We're working on it, but it's something that is a high priority for us. We have met with the GIC multiple times. They are working on it, and this would be a true win-win for everybody involved if we can find a way to transition all non-Medicare retirees into the federal Medicare program. The other thing we are doing is working very closely with the GIC, with state officials, and with the health insurance companies, whether it be Blue Cross Blue Shield or Unicare or the others, to find ways as we move forward that our members can save money and get these costs under control without shouldering you with more and more of the burden. And just in the last 2 months, in this very office, we have had senior officials from Blue Cross and from Unicare come here to 11 Beacon Street to sit down and meet with Mass Retirees officials to talk about these issues. Now, unfortunately, there are no quick fixes, and there are going to be limitations to what all of us can do. But the fact is, we are working together to find ways to get these costs under control. And we're going to be keeping you in the loop as time goes on as to what some of these solutions may or may not be. But we're working on it. It is a very top priority. A huge portion of our daily work here at Mass Retirees is focused on healthcare and getting these costs under control. But at the end of the day, here's the good news. The insurance that you have, whether it be at the state or the local level, is excellent. It is better quality and more affordable than most other people here in Massachusetts, and particularly around the country, have access to. And it's our job, and we take this very, very seriously, to protect that and to ensure that you're going to continue to have access to high quality and affordable health care for your entire life. It's very, very important. It's something that we take seriously. It's something that our colleagues, whether they be at the state, local level, or in the private sector, we're all working toward the same thing. But again, there's no simple solution. But we also have to, again, focus on the positive. Excellent insurance benefits, high quality, freedom of choice, and thank God we live in a part of the country where we have the best doctors and hospitals available anywhere in the world. The downside of that, it's costly. But again, thank you for your continued support of us. Thank you for tuning in to these video updates every week. If you have questions or suggestions, leave them below. If this is on Facebook, leave them in the comments below. We do read everything. I know that a number of state officials also read these comments. Let's try to keep it productive. But if you have topics and suggestions for future episodes, I'd love to hear about them. This is for you. We want to make sure that you're informed and that you find these interesting, and just let us know what your thoughts are going forward. But again, thank you very, very much.